Melanoma is actually directly related to the lymphatic system and your immune system. Melanoma, like all cancers, is a bunch of cells. So you're going to unblock this lymph system and you're going to free up all the white blood cells that are trapped inside. And they're all stuck because of these blocks. And they work when you take away the blocks in the lymph system. When you do that, you free up all the white blood cells. And so they're going to go out, and now they're going to go and attack all the cancer cells that are roaming around in the melanoma. And they're going to clean it up. Let's talk about what to do about melanoma. Melanoma is actually directly related to the lymphatic system and your immune system. It responds very quickly because it's relatively minor compared to other cancer cells. The reason why I say this is because I've seen in my office people who have treated themselves with chemo and people who have not been eligible for chemo, to see that both cases, chemo and non-chemo people, have been successfully been able to eliminate the melanoma in their bodies through holistic treatments. And the reason why I say this is because it's very fascinating to see how the lymph system and how the immune system works together to be able to reverse the melanoma. Melanoma, like all cancers, is a bunch of cells. The doctor does a biopsy, and he says, based on where the biopsy is taken and based on what it looks like on the pathology report, he says it's called melanoma. Fine. So what do you do about it? Well, you do chemo. Now, if he did the exact same biopsy and he found it in the lungs, he'll call it lung cancer. And he'll give it a name based on the type of cells that are affected, and he'll give it a name, and the treatment is still chemo. Now, there's different types of chemo for different types of cancer, but when you look at what they do, they try to stop the cancer cells from growing. But if your body made the cancer cells, that means you're going to stop the body from making cancer cells. But you're also going to be stopping the body from making other things. So if cancer is a normal process because of something else that went wrong, then if you're going to stop that process, you're going to end up stopping everything else that's still normal. And that's not right. Because you shouldn't have to sacrifice the rest of the body so you can actually handle one thing. Especially when the person is walking around, they still feel fine, and you're going to douse them with a heavy dose and they're going to get sick. The interesting thing about melanoma is the lymphatic system is so clogged up. The lymph system is so clogged up in melanoma that the best way to treat it is to unblock the lymph system. So you're going to unblock this lymph system and you're going to free up all the white blood cells that are trapped inside. And they're all stuck because of these blocks. And they work when you take away the blocks in the lymph system. When you do that, you free up all the white blood cells. There's nothing wrong with them at this moment. And so they're going to go out, and now they're going to go and attack all the cancer cells that are roaming around in the melanoma. And they're going to clean it up. Now, you might say, well, that sounds simple. Well, it is simple. How can it be this simple? Well, your doctor doesn't know how to unblock a lymph system. There's no chemo that can do that. Because if you're trying to stop something, you're going to stop everything. But if it's something that's blocked, there's no chemo that can unblock it. And that's very important because you can tell, because when you have a 4-year-old kid come into an office and they're not eligible for a treatment, a chemo treatment, and you apply this idea, in 2 weeks' time the lymph system deflates, the swelling goes down, and all the immune system is freed up. And when you have an older person, and because their cells are less active, you have to wake them up. You use herbs to wake up the immune system and the other cells into the healing mode. Same problem. You take away the blocks, you wake them up, and now you have an immune system that is entirely active and constantly breaking down the melanoma. The interesting thing about this process is it's that simple. And when your chemo doesn't work, in 3 weeks' time, 4 weeks' time, 5 weeks' time, 3 weeks' time, 3 months' time, think about what else you can do. Is there something in your lymph system that's not working? Is there calcifications? Is the lymph nodes spreading? Well, they're just blocked. If there's too many blocks in your lymph system, it just continues to swell, and there's not enough white blood cells there because it's trying to come out to try to destroy this cancer. And that's the simplicity of melanoma.